Now it's my pleasure to introduce Dr. C.T. Loy, who's going to join us, another great friend of ours from Hong Kong. Dr. Loy is a consultant in emergency medicine at Tuen Mun Hospital and has, for many years now, for a decade now, has introduced a system which we call EAED, which he will tell us all about, I'm sure, and how data and technology can improve the care that we give to all of our patients. CT, welcome, thank you very much. And I'll just remind everyone as you start, if you have questions for any of the speakers this morning, please put them into the chat and I'll be happy to put them to our speakers. Thank you, CT.
Thank you, Professor Colin. Today, I'm happy to share with you about my view and my experience in the digital transformation of ED and how to use the big data generated in the process. So, in the past decade, different industries have been working very hard in the digital transformation process, including in the healthcare around the world. And in the process of digital transformation, tons of data are generated, which are invaluable and could be even magical. So the Economist magazine had promulgated the concept of data being the new rule and the most valuable resources in the next decade. And high quality data are considered as the petroleum in the digital era. So I think most of us should have some experience about how to use the data in our daily life. And for example, when we are using the mobile phones and the social medias, we have already experienced the power of the data, for example, in the product marketing. So, and also the importance of the data have also been emphasized in the mainland China and also locally in Hong Kong. It is reinforced in the digital economics planning of the State Council of the People's Republic of China. It has described data as the most representative element in various industries, including the healthcare industry. So in Hong Kong, we also have a data society to push how to share and use the data. And in the science, in the scientific field, there is also explosion of the amount of the high quality data and also sophistication in the new analytic methods in this mega scale of data. This created a new arm of medical and biological science, and the era has been evolving from the commonly used megabyte, gigabyte, terabyte to the higher hierarchy. And in 2020, we are now creating petabytes of data daily. And in the next 5 years, it is projected to create up to the exabyte level. So how about in the situation in Hong Kong? And in the setting of Hong Kong now, Hong Kong is a metropolitan city, and we are one of the most densely populated area among the world. And we have more than 7 billion of people crowded in a 1,000 square area. And Hong Kong is one of the areas with the highest penetration rates of mobile phone and technologies among the world. Each of us had on average more than 1 up to 2 mobiles per person. And we consume a lot of data and create a lot of data every day. In the healthcare sector, in Hong Kong, 90% of the services are provided by the healthcare services in the public side, and is provided by the hospital and coordinated by the hospital authority. And we have 43 public hospitals in HA currently. We also have major progress of digital transformation and creating data in the past decade. And in HA, most of us are very familiar with our hospital information system. We call it the CMS, the clinical management system. It was one of the largest database in Asia in healthcare. It is a centralized system for all 43 public hospitals and up to 100 clinics in Hong Kong. We share the data through various platforms, including the Electronic Health Record project handled by the Hong Kong SAR government to the private sector. It had covered a majority of the clinical data in the day-in, day-out setting in the hospital operations. And with further digitalization of the workflows under the smart hospital development, in the recent years, the size of data is exploding quickly. And we are now more than 300 terabytes in 2 years ago. And now we are already close to the petabyte range already. So how about use the data? The accumulation of the data is of no use and value. So the importance is how to share and use the data. And it has been promoted all around the world, including in Hong Kong. The Hong Kong SAR government had emphasized and arranged the hospital authority to create a big data analytic platform to share with, particularly with the academic institutions. And it had been addressed in the CV's policy address in 2017. So data collaboration lab have been formed and have been already in operation and working with various universities and academic institutions on various big data researches. Internally, because we have thousands of physicians and up to 10,000 of nurses, and we also have an AI lab for internal exploration of how to use the data. So this is included a series of whole solutions, including a physical premises, the provision of the hardware, the software, the data scientists, and the health informaticians to work together. So the infrastructure had already been well formed and in operation. About the data catalog available in the healthcare data, because in the recent years with the digital transformation, not only in the emergency department, but also in other clinical workflows, the data catalog has been rapidly expanding. It covered baseline patient demographics, past health, the A&E data, the radiology, laboratory, operation, etc. Actually, everything detail of the patient's past and the current status are really available. So for the big data analytics and the AI platforms, the primary objective of all healthcare big data analytics should be finally to improve our healthcare services, to improve our service efficiency, quality, and safety of our patients. Just like Professor Tamorish had expressed how to make us sleep as a seamless workflow, how to get us lean and safe. So we target to improve our clinical service and also improve our patients' experience. So about the AI innovation process, in general, it could be divided into 4 phases. The 4 phases of the innovation development start from the discovery phase. So discovery and hypothesis is important based on the clinical observation by our clinical sense of the physicians. And it should be followed with a proof of concept on the feasibility. And if it is being demonstrated feasible, then a bigger scale pilot could be conducted to evaluate the practical issues and also the potential of scalability. If it is proven is a scalable solution, then the innovation could be generalized in all suitable clinical settings in the deployment. So actually now in the hospital authority in Hong Kong, we have already near hundreds of innovation in this innovation process. The potential of AI and big data analytics is tremendous. It ranges from the currently implemented radiology image analytics to other big data and analytics for clinical decision support. So various developments are now booming in X-ray and also all other parts of the world. So getting back to the situation of the Hong Kong, the emergency departments, let me share with you about the progress of digital transformation. So as Professor Colin had just mentioned, in Hong Kong, we have digital transformation projects of the ED, we term the EAD project. It digitalized all clinical and operational data of the patient, ranging from the triage, the patient's registration to triage, the investigations, consultations, treatments, to the discharge, and including the process of diagnosis coding, medications, radiology, and lab. So they are in structural formats, data formats, And also some of them are in free text fields because in consideration of the daily operations and the convenience. So nowadays there have been various investigation and utilization of the NLP technology, natural processing, and to handle this sort of free text data. So for better standardization, we also have some data templates for the emergency physicians and nurses to enter. So one essential note is that the quality of data is very good because they are legal medical documentations of high accuracy and also high quality. This is very useful in medical audits and research. So about the volume of the digitalized data, annually we have more than 2 million attendants to the 18th AEDs in the hospital authority. And currently up to date, 8 out of the 18 of the emergency department had implemented this digitalized workflow. And in the upcoming year, by 2023, we will complete all of the 18 AEDs digital transformations. And the data will be very useful in various applications. So also, not only on the day-in, day-out medical documentation, the digital transformation, we also digitalize all other relevant workflows, including, for example, the ECG, because traditionally ECGs are in paper, and now we also have a project covering the digitalization of the ECG data, which could also serve as infrastructure for the future audit and researches on the ECG. And the digital transformation of the ED also covered the resuscitation process. And in HA, there is an e-resusc initiative to digitalize the most challenging resuscitation workflow in the emergency department. The data generated in the resuscitation process are very useful in future development of the decision support, decision trees for patient care, and even up to the level of the protocol-driven resuscitation and other medical researches. So nowadays, we also have new advances and sophistication in the wearable technologies and the Internet of Bodies. And this will be very, I think most of us may have some experience. For example, use of the Apple Watch or other smartwatch on our hand. They have integrated a series of sensors to collect continuous biological data. And this could provide infrastructure for the future new era of patient monitoring. And the data could have dramatic effect in our healthcare provision model, for example, for ambulatory monitoring, and it will have tons of opportunities in medical research also. So up to now, we have a series of data available in our public EDs in Hong Kong, including the real-time documentation data under the EAD project, the resuscitation data, there's a various sort of clinical photos, ECG data, lab data, radiology, etc. So how do we use the data is the most important. So it improves our ED management and operation. It provides a basis for the AI support for the clinical decision making to provide smarter care. It is an enabler of telehealth and telecare, and also for clinical audit and research, including the big data analytics. So what are the implications? So first, I will introduce how are we now using the digitalized data to support our ED operation. So it can provide data to create dashboards and also sharing the data with our patients through the mobile technologies. So it is particularly useful in the winter surge and also in case of mass casualty incidents to assist the coordination of the operation. So various types of data display have been set up to facilitate the daily operation of the ED to get us lean and seamless. And the clinical staff could easily take reference in the to-do list for the outstanding tasks for a particular patient. And also we have various sort of patient lists and dashboard to assist the daily operation. Based on the data display and the dashboard, throughput can also be monitored of the emergency department, and the workflow stress zones could be identified and notified. And this could facilitate the manpower resources deployment to optimize the service efficiency to our patients. And digitalized data is a basic enabler of telehealth. And we have set up a prototype telecare model in the New Territory West cluster, and for the remote consultation and conjoint resuscitation with intensivists in the ICU of another hospital. It included a very sort of multimedia, including the digital stethoscope, point-of-care ultrasound, etc. But you need to imagine if the patient data is not accessible in digital format, it is virtually impossible for the intensivist to access the patient profile and clinical data. So digitalized data and the patient real-time clinical data is a basic prerequisite. So to getting further how to develop various sort of AI, now we have a series of diagnostic AI have been implemented in the hospital authority. And this is one of the best example because this chest X-ray prediction model have been implemented in all 18 EDs under HA. So it includes detection of the lung lesions, and the most important is the workflow integration and the process automation. Because in the medical research and literature, there are a lot of these sort of AI models already, and some of them are already have validated. But how to use and implement in the daily practice is challenging. It includes not only the model accuracy, but also how to integrate in the clinical workflow. And not only on the chest X-ray, we also have been piloting how to use the AI for the CT brain to detect intracranial hemorrhage, and also the correct position of the nasogastric tube. We also are going to implement hip fracture detection, which is automatic detection of any patient with hip injuries. And one of the good and essential success factor in implementation is to integrate into clinical workflow. And also during the integration, the physician's feedback and data is essential because it is to serve as the future further training and self-learning of the AI models for even better accuracy. So to elicit the power of the big data in the clinical form, we need a series of pipeline, not only on the model accuracy and the quality data. We require organizational support, the legal and liability clearance, integration to the clinical workflow through the integration with the hospital information system, and also manage our healthcare professional expectation. And a series of pipelines are essential to for the landing of how to use this sort of model in our clinical practice. So in fact, I would like to also introduce another newer concept called digital twin. This is a hot term in the recent years of in the digital world. And actually this sort of data is already highly available. For each patient under our care, they are represented by a series of data in the digital world. And this is the digital twin of the patient. The data include the patient's health record, the real-time vital signs, the data from wearable, lab radiology, and job, etc. So this digital twin is very useful for personalized and the development of the precision medicine. And with the infrastructure, various researchers, including us, we had already kicked off to start the development of various prediction models for the clinical decision and the services. And in the emergency medicine, we focus on triage decision, the prediction of short-term outcome, for example, mortality and the ICU admission, and the risk stratification of sepsis, geriatric fall risk, and reattendance. So not only the model is important again, if an accurate model is available, then we need to consider how to integrate in our clinical practice by the pipelines to assist the clinical decision of our patient. And this is useful for the care standardization. And now we are not only talking about digital twin, but metaverse, 元宇宙. This is a concept how to integrate AI, AR, VR, the 5G technologies to create a virtual perception of human. And all of them are all based on the big data. And in the context of healthcare, some areas have been exploring how to use the data to create this sort of metaverse to provide virtual healthcare and virtual hospitals. And on medical researchers and the big data researchers, the number of big data researchers is exponentially growing in the past few years. And you can see in this review that the publication is going very quickly. And there are already some high impact factors in medical informatics and big data analytic journals. For example, the Lancet Digital Health is primarily focusing on this development. But big data is not without risk. So one need to bear in mind that the rapid development of this sort of infrastructure and application, we carry the risk of being overwhelmed by big data. So we need to always bear in mind how to use the big data, how to interpret the data and use the data is important. Not to mention about the cyber security, data privacy, and the technical dependency of the issue of the big data. And in the digital era, we are now talking about data literacy. Data literacy is the knowledge and skill to read, analyze, to interpret, and to visualize the data. So I think it's difficult to be outstanding or survive as a data illiterate in this digital era. It has been discussed, including the data literacy starting from the childhood, college, school, and we may need to consider this to be integrated in the future medical curriculum and education. So with the global digital transformation of the healthcare industry, the role of data literacy is getting more important. We would need to consider and plan in our medical education and medical research training, and to promulgate the concept of digital health leadership in our future healthcare leaders. So this is the end of my sharing. Thank you very much.
Thank you very much, CT. That was fascinating and slightly terrifying, but fascinating. I learned 2 new words today. I've never heard of a petabyte before or an exabyte. It amazes me that they even go as high as that, but there we are. Thank you very much indeed. That was an excellent talk. And as you highlighted towards the end, the implications for emergency medicine research are enormous, but also for education. I mean, where would you be putting that education in year 1 of medical school, year 2?
Actually, for example, in Hong Kong, the training in data literacy start in the primary school age and continue in the college, and also I think in the university undergraduate training should already been started, and but it had not been emphasized in our, for example, fellowship training in the EM in Hong Kong yet. So I think we may need to export, because the learning should be continuous, because the analytic and the requirement in the data literacy is always continuously growing. So we need to keep our trainees and the fellows up to the standard in this digital era.
Well, I mean, that's what strikes me. Just looking at that graph, that exponential rise in research output, I mean, that correlates, of course, with an exponential rise in the need for knowledge, which means we need to be starting 6 years ago. But obviously, we can't, so we've got some catching up to do. Dr. Lim from Singapore has sent in a question, which I'll just read to you. It says, have you considered and computed the costs of archiving all this data? So, for example, could you cull or delete the data of patients, for example, who died more than 10 years ago, or would you think it's necessary to continue to archive that data for big data research? Great question.
This issue have been discussed because we are one of the biggest systems in healthcare in Asia, because we covered hundreds of clinics and a lot of A&E and also 43 hospitals. We have been discussing if the expired data should be archived or even erased. But because the cost per terabyte, or now we are talking about terabyte, petabyte, exabyte, the cost of the data storage is dropping very quickly at the same time. So up to today, we are not deleting any of the old data. We are still archiving. And I think it also have value because when we are conducting some sort of retrospective analysis, and the amount of data will be more. And if we have not archiving or deleting this sort of old data. Actually, in our system, we are storing some data up to 20 years already.
Fascinating. I mean, again, I would agree with that from a research perspective, but I guess there's a cost in terms of money. I guess there's also an environmental cost associated with that in terms of big data storage and heat production and such, like, global warming. I'm no expert on that, but I know from where I come from in Scotland, many of the data centres in Scotland are actually on the coast because you can stick them in the cold waters of the North Sea to cool down the equipment. Whether that will become an element as well, I don't know.
Yes, I also agree. So this because we are also going forward. For example, 20 years later, we may also need to consider those really expired data. We may need to erase or have some rules to govern on the data.
Some threshold. I suppose the other thing ethically is how long do you keep the data for someone who's died? I was seeing something when I was looking at Facebook the other day, something I don't do very often. I came across something that said, what would you like to be done with your profile when you die? And I thought, I've never really considered that before, digital presence after you've died. The same, I guess, goes for healthcare records too.
Yes, I agree. But I think we internally in Hong Kong under the hospital authority, we always have a regular review on how to manage those expired or the patient data of the disease. I think this also involves some ethical consideration.
Absolutely, fully agree. Last question I'm going to ask you. When can we look forward to a completely paperless ED? I mean, are we almost there? Yeah. I mean, are we almost there?
Actually, we do have a tentative timeline to become completely paperless. So why do we want to get paperless? It's not only for environmental friendliness, but when we are established to this time point, the efficiency and the throughput of the ED will have a dramatic improvement. Because now we have some loose paper in our workflow. So these loose papers are actually hindering our smooth daily operation. So we are also targeting for this totally paperless. So in our tentative timeline is around 3 years in some of the hospitals.
I will look forward to that. I think that would be a huge step forward. That will be great. CT, thank you very much again. That was a superb talk, and we will look forward to more discussions on this as we move forward. Thank you so much.